I'm Dan Howell, by the way, state representative, and we're here this afternoon to let you know and let the people of Tennessee know that it's time for the insurers, the health insurers of the state of Tennessee, to quit practicing medicine without a license. I know that probably is an inflammatory statement to some, but it is the truth. It has happened to me. That's why I'm here. That's why I wrote this bill. And when I looked around at what happened to me and I looked around at what's happening in the state of Tennessee, something had to be done. And so I'm glad to say that we are here today with a lot of support, as you can see, and lots of doctors. You'll be hearing from some of them. Some of my colleagues, you'll be hearing from some of them. But House Bill 2619 and its companion Senate Bill 2155 establishes new safeguards to ensure fairness, transparency, accountability in health insurance claim review practices. It regulates the use of artificial intelligence in medical decision making. AI is being used in medical decision making in your care. It creates a new commission to oversee insurance review complaints that will be enforced by the Attorney General's office. There are several key provisions. I'll go through those quickly and then we'll move on. Artificial intelligence oversight. AI claim reviews must be approved by a qualified medical professional. Recently, if you listen to the hearings in Congress, before one of the committees there, the health CEOs, health insurance CEOs, one of them said, "We like AI. It can deny a claim in 4 seconds or less." I noticed that he did not say we can approve a claim in 4 seconds or less. He said we can deny a claim in 4 seconds with AI. There are also, according to the research that I have done, and I've been working on this for over 2 years, according to the research that I have done, they are now bundling claims together, putting them in a basket, so to speak. It may be 100 claims, it may be 50 claims. They run them all through AI without any oversight from a medical professional. And they say they can deny all those claims in 1.2 seconds. That's absurd. And it's time that we do something about it. The Tennessee Commission of Insurance Review creates a new dedicated oversight body to hear complaints, conduct investigations, and enforce compliance through the Attorney General's office. The goal is to increase accountability and offers a structured avenue of resolution. Another key provision is that it prohibits downcoding and underpayment. Insurers may not reduce payment through improper coding practices. Another key provision is 60 days notice to change a contract with a medical provider. In my district, my hospital, Representative Raper's hospital in Cleveland, one of the major health insurers notified our hospital overnight, without any proper notice or prior notice, that they were immediately removed from the Medicare Advantage network. That really upset me, because in my district, people who use that hospital, there's about 8,000 to 9,000 people who are on Medicare Advantage who now have to drive 45 miles to Chattanooga to get the medical assistance that they need. These things should not happen. So now there has to be prior notice of at least 60 days if you're going to change the contract. Medical data. It must stay in the U.S. Many people are not aware that their coding is now being done I read one report that estimated at least 61% of the coding done by our insurers is done outside the United States. That's unacceptable. reimbursement equity across provider types. It prevents insurers from paying different rates based solely on license classification for the exact same service. I have seen data with my own eyes. I've read it. People with the same license, same certificate of medication, working in a walk-in clinic who perform a service that a major hospital might perform in Chattanooga, they pay that provider in the walk-in clinic 1/3 of what they pay the hospital in Chattanooga for the identical medical care with the identical license. That is wrong. It requires transparency. When an insurer owns part of a medical provider, we've discovered that many of the medical insurers, health insurance companies, are buying up medical providers, hospitals, walk-in clinics, medical groups. I believe we have one representative here who may talk about that. And what they do when they do that, they put that medical group in their network, and you have their health care, and they make sure you go to that hospital, that medical service in their network. And what they're doing then is when you file a claim, they're paying themselves. It's got to change, and it's time that we did something about it. I would like to, before we go to question and answer, I would like to call on a couple of my colleagues, and I'd like for Representative Tim Hicks, if you would come forward on this side. There you go. All right. This side. Sorry.
Good afternoon, Chairman Howe. Thank you. Thank you for this legislation. It is extremely important legislation that you're bringing. I like to call this the Tennessee Patients First Act. Is what I like to call it. You know, when we go around our districts and we ask our healthcare providers, you know, what's the state of healthcare? What, you know, how are y'all doing? What's going on? They really and truly have a hard time answering that question, because sometimes I don't believe they really understand what direction that healthcare is taking. One of the reasons why we believe is because a lot of our larger insurance companies are actually inserting themselves into healthcare. They call it vertical integration. I've heard that word a lot lately. And, you know, I think Representative Scarborough will probably talk about this. They own the PBMs. And so they sort of dip into your pocket both ways there, to be frank. They are acquiring a lot of private practices across the state of Tennessee. They acquired one that I go to, actually, in Northeast Tennessee. And it's sort of proven through the federal government that, you know, they're paying their own providers, their own people 17% more than they're paying their competitors. So that's a real issue whenever that comes down to it. A lot of people don't understand this, but we have a large insurance company in this state that is the biggest employer of doctors in America. Okay? They employ 11% of all of doctors in America. That adds up to about 100,000 out of 900,000. So remember that. One insurance company is there, and what they do is they, through the Medicare Advantage program and different things, they steer patients. And this bill addresses every bit of that. In my district, our local hospital currently, this large insurance company owes our hospital $65 million for down coding. That is a huge number. It's currently being litigated, but that is exactly from down coding what they owe. They're able to pay themselves more, and it's time that Tennesseans realize what's going on. And I look forward to try to putting some kind of guardrails on this. And I believe this bill will be a bill to get that started. It'll put good guardrails on it, and we're excited about it. So, Chairman Howe, thank you very much for bringing this legislation. Thank you, guys.
Thank you, Representative Hicks. There are a number of bills that are in this, I'll call it bucket, this session. Some of them, I'll just list some of them. Senate Bill 2550, prior authorization reform. Senate Bill 2040, pharmacy benefit manager. And that's something that many people are concerned about. And here to chat about that, I believe we're going to ask Representative Rick Scarborough to come forward.
Thank you, Chairman. Thank you. And I will be brief. House Bill 1959 is fundamental conflict of interest. Now, prescription drugs are managed in our state. It ensures pharmacy decisions that we need to make sure that our bill restores fairness in the system. It ensures pharmacy decisions are driven by the patient's needs and not corporate profit. And again, not only do I support Chairman Howe's bill, but again, as he said, this is a bucket. This is a bucket for us to focus on Tennesseans and focus on patients. And again, for those that oppose our bill, it's time to focus on the patients and get away from the corporate profits. And again, I appreciate your time. Thank you very much.
Thank you, Representative Scarborough. Also, to talk about the PDM bill, Representative Alexander is going to come and talk about that. Shannon?
Good evening. My bill is actually about step therapy, and it's about changing the way we treat patients with cancer. My bill number is HB 1956, and what this bill does is it allows doctors to treat patients in any staged cancer that they have with the drug that they need and not be forced to try drugs for 3 months. If we can get a patient who has stage 1 or stage 2 cancer and we can give them the right drug, we have saved a life. We've saved a mama, we've saved a dad, we've saved a mother, we've saved a grandparent. Those are important things that we need to do. We need to put patients first in this state, and it's time we start doing it. So I'm honored to carry this bill.
Thank you, Representative. Also, we have Representative Hakeem, one of my friends that I've known for 3 or 4 decades, I suppose. I knew him back when he was on the city council in Chattanooga. Do you have a comment you want to get about that?
Thank you very much, Chairman Howell, for leading this process. And what this says to me is that there are a number of average citizens out there who get an answer, no, we don't cover this, or no, we're not going to provide X, Y, and Z, and they don't know what to do, how to do, and could just sort of die on the vine. But this bill creates an opportunity for people to be informed, for transparency to be there, and I think, in my view, it helps citizens, period. And I believe this collection of leaders you have up here says that we want to do what's in the best interest of the average citizen. So I would hope that you look forward to seeing what comes next. Thank you.
Thank you, Representative. We have a number of health providers on the stage here, and let me just read off a few of those. We have pharmacists, we have Orthopedic Society, the chiropractors, we have the Tennessee Medical Association represented here. Physicians' assistants are here, Nurses Association. We have patients in this room who have been denied. We have anesthesiologists and representatives from TANA, and also with us today several doctors, and I believe Dr. Bowman with Dawson. Dr. Bowman, there you go.
Hi there, thank you, Chairman. Tennessee Orthopedic Society is a proud sponsor of this bill. And it's because our goal is the same, and that is to provide excellent care to the patients in Tennessee. As you know, as probably patients yourselves, the patient-doctor relationship is a special, very important relationship built on trust. And unfortunately, with the insurance companies, it's a more adversarial relationship. But our goal should be the same. And that relationship should be built on trust. And trust has to have transparency. And so that's the problem that we see with the current system, is that we have large batch denials with no transparency as to why this is occurring. And so what we're asking for is for reform in this area so so that we can continue to provide the care that we need to help our patients. Thank you.
This is, as you can see, is a bipartisan bill with broad support, and we hope that the insurers are paying attention. The people of Tennessee are tired of being denied. I read one statistic that 81% of the first claimants, the first people who filed, like myself 2.5 years ago when I needed surgery on a muscle in my leg, 81% of them are denied first time. That's absurd. The doctor says you need surgery. The x-ray says you need surgery. The MRI says you need surgery. But the insurance company says, no, you need 9 weeks of PT. That again is absurd. And we're tired of it. And the people of Tennessee have spoken. And we're here today to let them know that we are listening. Anyone else up here would like to say a word? If not, we'll be glad to open it up to questions.
I have a question for you. Obviously, it's comforting to take the decision out of AI, but what's to stop them from having one of their minions make the same denial in 4 minutes? Because the problem is, as you articulated, denials and procedures. That's the problem. Where, maybe I'm missing one of this. How do you get to that?
Well, it's taken us a while to get to where we are. It may take us a while to get to reverse it. But what this bill says, you can use AI, but you can't use that as your sole decision making. It has to be reviewed by a medical professional, and that's what we expect, and it's going to be backed up by the AG.
Yeah, the insurance companies have just a little bit of sway up here.
You think?
You have a strategy for pushing this through over their opposition?
By just simply telling the truth, showing the facts, and working hard. And I think you see here that we have a lot of support. So the strategy is just to move forward with determination. I have seen bills come to this legislature that sometimes it takes 2, 3 years, maybe 4 years. In fact, a colleague of mine has a bill that this is his 9th anniversary of bringing the bill having to do with another topic. But the more you make people aware and educate them of the need and the problem, the greater chance you have of eventually succeeding. So we're just going to move forward.
Do you feel like this is more of the start of a long-term fight? Are you feeling like you can push something through this session?
I certainly hope so. That was my intent. I didn't write this bill and sponsor this bill to fail. But not every piece of legislation that comes up here succeeds on its first attempt. But I feel confident based on the support, and I've got 38 co-sponsors which are bipartisan. I also have some of the leadership signatures if you've looked at the people who have signed up to co-sponsor. I feel confident we'll get it through the House, and we'll see what happens in the Senate.
Do you expect to have the support from the speakers of the House and the Senate, and also where is the governor on this?
Well, the Speaker of the House was the number 2 signature on the bill, so I think I have his support. I can't speak for the Senate. I know Senator Watson is working hard over there, but it will face a challenge in the Senate, and I admit that. But if we don't succeed, we'll try again.
What about the governors?
I have not spoken to the governor.
You all
Can't
plan
speak.
to do that?
I'm willing to speak to the governor if he would like to talk about the subject. I'm sure he's aware of the problem.
You know, there's no question that the people want this, right? There's no question what you articulate. Any of us with white hair have had this experience. But the thing is, the question is, this is like an overwhelming popular idea. Why is it so difficult to do anything about it if you can be very direct with that?
The large insurers, and you know who they are, have so much money, and they are so powerful that it is difficult to overcome that. But I think when you have a grassroots uprising, like we're seeing in Tennessee, and I hope that Tennessee can lead the wave across the United States, because we've led the way in many other areas. I hope this will be a beginning of leading other states into taking action, because all we can do in this bill, we can't regulate what the federal government regulates. That's Medicare Advantage. But we can regulate commercial insurance, and that's what this bill addresses. So I'm hoping that we can start a wave, because when my constituents learn, as I did, which I wasn't aware of this, but now I'm very much aware of it, when my constituents learned that since 1999, health insurance coverage has increased 340, the premiums have increased 342%. But inflation has increased 64%. That gives me pause to say, what is the driver behind this? It's not inflation. Is it the stockholders? Is it greedy CEOs? I don't know. But I know it's got to be fixed.
There's some questions in the back. Any more questions?
Thank you for coming.
Yeah.
Appreciate you much.